Okay, we now welcome Mr. Anthony Sivers.
Okay, thank you very much, sir.
How long have you had diabetes?
I would say roughly over 25 years.
25 years. Tell us about your experience with the Barbados Diabetic Eye Screening Program.
All I can say is something that you should do as a diabetic because the kind of complications you get with associated with diabetes, as far as like cataract. Yes, I would say that the Diabetic Foundation, they're very, very, very good in performing their duties. They're doing a very excellent job out there. Met a Dr. Prophet, because I was suffering with because of diabetes, I had some complications. One time I went there with an ulcer, and it wasn't getting better. And thanks to Diane Prophet and Dr. Laurel, they put me on thing to reconstruct my way of looking at diabetes. And it was out of control. I was self-employed. I was a restaurant operator. And despite I used to serve some good meals and things to people, I used to eat very badly. Not on time, not eat the right things, and that spiked my sugar levels out of control. And I get to realize over the years as a diabetic, if you don't have your sugars under control, even if you have a problem with ulcers or cuts or things, is a problem in healing. Because if your levels are not good, you create problems.
So you would say that the advice that you got from the Diabetes Foundation was helpful in helping you to cope with your diabetes?
Very much so, and I will recommend anyone. A matter of fact, I did do some recommendations to a couple of friends of mine. I had a friend of mine that was going through some problems in the hospital, wanted to remove his toe. And I told him, no, boy, I think the only way to go, because he was a retired mechanic. And I told him, you go and check out the Diabetes Foundation. And he went there for about 3 months or so. Within 3 months, he was healed. And he's back out working again. Although he retired, he's still doing his own private work. So I will recommend the Diabetes Foundation, very much so.
Wow, that's excellent. So would you advise persons to also have their eyes checked regularly?
Very much so. For a long time, I was prolonging not to have my eyes, I didn't to get an eye screening, eye check for a long time. But because of I had a cataract operation 5 years ago at the hospital, and then when they would go to the hospital, because of the amount of people that goes to the clinic there, you don't always get special attention. And just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with what they did with the result. Well, I still have a glaucoma. I'm battling the glaucoma, and right now the cataract is under control. So I would say yes, that is very good. It's very good for diabetics.
So if you were going to rate the screening program between 1 to 5 stars, how many stars would you give them?
I would give it a 5-star.
Thank you.